All right, everybody, welcome to another episode of the Macro Perspective. And today we are bringing on DPT PT, Dr. Kelsey Changsing, and she's going to go ahead and give us a little rundown. We're going to just kind of shoot the breeze a little bit, talk about performance physical therapy, and really just dive into what that looks like. And also, I mean, you definitely do something a little bit unique. It's probably a little more traditional now, but I still think of it a little bit non-traditional in the realm. So virtual physical therapy and what that can look like. So Dr. Kelsey, thanks for coming on. And yeah, maybe just give the guests a little bit of an introduction of who you are, what you've done, and how you got here.
Yeah, thanks for having me. So I'm Dr. Kelsey, a physical therapist, and I own Anteater Physical Therapy and Performance. I've been a physical therapist for about 4 years now and working on my own practice for the last 2 years. And like Marco said, I do virtual physical therapy. So really what that looks like is I take out all the fluff. So what I deliver to my patients or my clients are really the bare minimum of what they need, and it just makes it super time efficient. And because at its core, physical therapy at its core is the exercise prescription, and sure, sometimes you need some of that manual therapy, aka the massage or what have you, but at its core it's that exercise prescription. And I found while working in a traditional clinic that a lot of times, a lot of people don't have time to go to the clinic. Either they're working, the clinic's only open during work hours, or maybe they have kids and they have to juggle that. When I started my business, I wanted to make things as time efficient as possible. And so with virtual physical therapy, I deliver their exercises digitally or virtually, but it's not just following some template or paper. It's an actual individualized plan that I'll be following up with every week and changing things as needed. So if exercises are too difficult, then I can maybe regress them a little bit, and vice versa. If they end up being too easy, I can make them a little bit harder and adjust as we go. So that way, we're making sure that the exercises I'm giving to my clients are appropriate throughout their whole plan of care. So
Yeah.
yeah.
And
That's pretty cool. I like that. Question though, because it's individualized programming, the diagnostic portion of it, do you do that in person or can you do like a virtual diagnostic too? Like, let's say someone, I don't know, you look at their posture with photos or video or something like this, or how do you do it?
Yeah, so I do virtual assessments, but for people who are local to me, I'm also mobile, so I go to either their home or no one's taken me up on going to a gym, but I can go to a gym. But basically, for a virtual assessment, it's looking at things more functionally because obviously I can't do a more traditional, what we call strength testing, where if anyone's ever been to physical therapy, it's like when they're kind of like pushing on you and checking your strength. Those aren't 100% accurate, but that's an aside, as an aside. But anyway, so for a virtual assessment, I'm looking at more of a functional movement assessment. So what that means is, for example, if someone's coming in with knee pain, I'm going to see, okay, what does their squat look like? Can they do a one-legged squat? Are there differences side to side? How do their hips move and things like that? So there's actually quite a bit that I can do virtually as well.
nice. And so you mentioned, performance, obviously, and I know you a little bit deeper than Seamus because of our business networking group and whatnot. But like, what does it mean to have somebody that's in like the more of a performance mindset with PT versus someone that might be kind of post-operative to you? Like, what is that level of like cadence and care kind of look like, and how is it differentiated from just somebody coming off of like a knee surgery or like an injury?
So I think I know what you're asking, but because my answer is going to say it actually doesn't really necessarily depend on the type of injury or like if they're coming off surgery or an injury. For me, it's more on the lines of what is that person's goal, because even somebody who's fresh out of surgery, thinking long term, like, okay, what are you wanting to get back to? Because obviously there's going to be a difference if somebody had knee surgery and all they want to get back to is being able to maybe go up and down the stairs to their apartment and like watch TV, versus somebody who just came out of knee surgery and eventually wants to, let's say, go back to playing soccer. Like, I'm going to be treating those two people very differently. Maybe not initially. Initially is probably going to be the same, but I'm going to have these two people are going to have very different goals. And I kind of lost my train of thought. But then, so when you're saying, so in your question, are you asking more like, how would I treat somebody with more of a performance mindset versus somebody who's just happy to be able to walk normally?
I think you kind of said it indirectly with regards to like it's really about what you're getting back to, which kind of dictates what would go on and how far to progress it beyond that. Which
Mm-hmm.
again for us, what we call the performance health space, that's our other job titles. We're looking at being able to get people to the highest level of their peak performance and given their like age and longevity, right? Like, so it might be if we use our classical patient kind of archetype, it's about a 52-year-old male, right? What is a 52-year-old male typically doing in today's world? There's generally a lot of golf, right? So like, I mean, like their return to play or little, instances of like issues are probably like rotation, anti-rotation, things of that nature, right? And that's really why I wanted to like kind of bring you on and talk about that, because in a world where it feels like a lot of our coaches that are dealing with patient care in a sense, right, where we're in a concierge kind of setting, we're actually looking for someone just like you, right? So it's like, how would we then be able to tell those people, hey, like a great option for you is actually this like kind of remote practitioner, because yes, the plan is more geared towards you and your goals, right? They love that kind of personalized touch, but then also we can only take them so far because our expertise is not like rehabilitation. Our expertise is
Mm-hmm.
like we can write a different kind of training program and maybe maximize hypertrophy and performance in a different way. So, as you were to, if you were to dive into that, I think you mentioned in the mess when I was messaging you, like kind of an avatar, like an individual or like an older patient that you worked with. I think it was like 78 years old, right? Do you mind like kind of bringing that story up a little bit more and like how you were able to do what you do?
Yeah, so yeah, I think I have a better understanding of what you're trying to ask. But yeah, basically, for at least for me, when it comes to performance, it's like what does the client want to get back to? And also taking away some of, well, I guess I don't want to say taking away my biases, because my bias is that everyone should be able to do what they want to do for as long as they can. But I guess it's more like taking away some of like maybe cultural biases, because I think in and I because I think a lot of times when people get older, they're like, maybe I should stop doing this because I'm like, maybe I shouldn't run anymore because I'm 60 now or what have you. So there's kind of that ageism, I guess, so to speak. So I'm going in a roundabout way. So for me, performance is more like, what does the person wants to get back to doing, and taking away some of those, gosh, what is it called? Taking away some of those like common sense things where it's like, oh, well, of course my back hurts because I'm old, or I shouldn't be running because I'm old, or so to speak.
Uh-huh.
But so, sorry, I'm like all over the place. But so with that, the 78-year-old patient that I was treating, he was still playing ice hockey basically. And at
Okay.
first when I read his chart, I didn't see his picture, or well, I think the picture that they usually have is like their driver's license photo. So I'm like, I don't know how old this photo is. So but when I read when I was reading it, it's like 78 years old, and he's like wants to play ice hockey. I was like, this is very interesting. And then when he shows up, he doesn't necessarily look his age. He definitely looks way younger, and he comes in and basically all he has is knee pain. Yeah, there's arthritis, and that was what was causing his knee pain. But I feel like if he had gone to a different clinician, if he had gone to somebody else, they would have probably tried to convince him not to continue to play ice hockey. And obviously, like the league he was playing in, it was one of the like non-contact ones, so they're not like tackling each other or anything, but they're still on the ice. And so, I found out, like, coming from him, he was telling me like ice hockey is very important to him, but then now he can't really play, and he's like afraid if he falls on the ice, like it's harder to get back up, and he's just trying to decide if he needed a knee replacement or maybe shouldn't play ice hockey But as he's talking, you can definitely tell like how bummed out he was that like he was, or even though he wanted to continue playing hockey, he was sort of on that mindset of like, maybe I should stop. And you can already tell like how bummed out he looked at the idea of stopping before he was ready mentally. So but again, my bias is that everybody should be able to do what they want for as long as they're safe about it. And so I really helped him improve his knee and get to the point where he was actually even he was able to go back on the ice, and he was also able to recover. Like if he slipped and fell on the ice, he was able to get back to standing more easily than he was before his knee pain started. So I think
Yeah.
so. Yeah, that was one of my
Like that.
favorite clients
I
to
like
work.
that story because, like, so when I was going to school, I wanted to be a physical therapist as well. It was interesting because when I was doing like some of my internship hours and stuff like that, the best things that I got from my mentors was like, don't work with physical therapists that say this person can't do the thing. Because at the time that was the motto. Just like,
Yeah,
you got running pain, don't run. As opposed to, can we find a way to modify training, modify volume, modify load? What kind of therapies can we do so that you can go back to what you want to do? Because for a long time there, they're just like, yeah, if you age out of it, quote unquote, you just can't do it anymore. I just don't think that's the truth. I agree. Like, even though like we try to get our bias out of it, I think it's a good bias because it's like we want to have our people go as long as they can into something until they decide not to. So I appreciate that about like that type of coaching. And what I love about your background, I don't think we got into it, but it's like your background is more that physical background. Like you have a background in the Air Force, by the way. Thank you for your service,
yeah,
and CrossFit. So it's like, I think when you have a physical therapist that can marry like strength and conditioning and like a physical training, I like those types of physical therapists because they know how to like get you back to play, as opposed to physical therapists that have never played any type of sport.
yeah,
They just have DPT behind their name, but they don't have like a CSCS or anything, and they're like, yeah, you're not going to be doing this, we're just going to put you on stem, and we're just going to do manual therapy. Oh, we're not doing any strengthening, doing any of that. And it's like, well, obviously this person can't do anything. They're just being here massaged all day, feeling good, and then the moment that they get back to running or like playing ice hockey, they're going to cut their knee again because you never addressed the
yeah.
actual issue.
Yeah. Serious question though. What percentage of physical therapists were people that played sports? Do you think it's over 50%?
I don't know. So that's a weird, it's one of those weird things that like, so when I was going to school, it was kind of like the stereotype that all the, because I went to Turo, and so they also university, so they also have like a DO program and a PA program and OT. So it's like all these disciplines, and the stereotype was that all the athletic people were the PT students.
Mm.
However, it's weird that in our profession, like physical therapists are notorious for underloading patients. So it's kind of like what Seamus was saying. It's like, okay, like an athlete comes in with knee pain, and then like this hasn't been the case for the clinics I've worked at, but it's like, oh, the clinic only has dumbbells up to 5 pounds or something stupid like that. Like, and so it's like this weird, I think there was just a shift. I think it was that's like the old school way was to like preserve it, like don't wear out your joints more. And then now that more research is coming out, and I think there's been like kind of a shift to more of like the physical side of physical therapy. I think more of the people that are maybe newer, maybe graduated in like the last 5 or 10 years, are definitely the more active individuals and are starting to load their patients a little bit more, because I think it also really depends on who their mentor was. I was really fortunate to have my first clinical instructor who, because I ended up working at that same place when I graduated, she became my mentor. She had her sport, or her SCS, so that's like the sports certification for physical therapists. So she was also very exercise based. And so I was fortunate to not be afraid to load patients, but I think a lot of new grads end up, if they have like an old school mentor who are like, oh no, just the massage and e-stim all the way, then they get very afraid of hurting their patients and loading them
Yeah,
up.
I wanted to
Mm.
ask you on that because there, over the last 10 years, like I still don't understand pain science. Like
No
to
one
this
does.
day,
No one really does.
to this day, like that age old adage of like, someone has back pain, you open them up, there's nothing wrong with their back. And then
Yeah.
like someone has no back pain, but they open them up, but their back is like a train wreck. So I'm like, what is pain?
I
Like,
have seen that in real life. Well, not the opening up, but like on the x-rays.
yeah. So maybe like, I guess maybe is it because like physical therapists were like quote unquote coddling their patients because like, oh, they're fragile, they got hurt, all this. But then there's like patients that like have pain but don't have any like, well, their knee's not out of place. It's just like they're dealing with pain. So it's like, how do we deal with that place where, can you push someone to a pain? Let's say you take them to a range of motion, anatomically it's safe, but their mind just has to, I don't know, just accept the pain. And then once they accept the pain, they're like, oh, knee joint, you can go in that range of motion and the pain's gone. Like, can you talk about that a little bit? Maybe like, I mean, maybe is that like the physical therapists are now like, no, we're going to take them to those places now?
I think so. I think it has to do with like the shift of going from just what's called the biomedical model. That's what a lot of physicians use, where like you're saying, it's like, oh, well, if there's pain, there must be something like damaged, like pain equals damage. But now it's more of like the biopsychosocial model. So it's like obviously biology, but then also like the psychology of it and then societal factors. And so I think, and also like there's a little bit more of an emphasis on the pain science. I really believe it's just more, we have more knowledge now versus like 20 years ago. So things are constantly evolving. But anyway, so back to more of like I already forgot what the question was.
The bio.
Model of pain. I like that, like the biopsychosocial model of pain, like talking
Yeah.
about taking people to pain in therapy or like taking
Okay,
people to
yes.
threshold or something like this. Yeah.
Yeah, so the way I explain it it's something that it definitely needs to evolve as a clinician. So I want to say, I think it took me at least like a year or two to get in a really good place of having like incorporating some of that pain science stuff, because a lot of a lot of times when in school when they introduce us to pain science, we're like, oh my gosh, this is like this amazing thing, but it's like it's so abstract, and so we're trying to explain it to the patient and they're looking at us like we're crazy. Either one, they look at us like we're crazy, or two, they get mad because they think what we're saying is all in their head, which technically
Technically, it
yes,
is.
but like technically yes, but not in the way that they think that we're saying it.
Your nervous
So
system is attached to your head, and that nervous
yeah.
system in that specific spot is feeling some type of way, and your brain is connected to it in a way that's not liking it. That's the best way I can explain it.
Yeah, so it's like this whole thing. So now I've realized, like, okay, first of all, we can't lecture them because they're like, after 1 minute, they're just gonna eyes glazed over. And I've seen that. I've definitely been like, oh my gosh, I'm talking too much. So it's more like being okay with the discomfort and trying to educate the patient on like, okay, what's okay, like okay discomfort and what's not okay discomfort. And I will say, as a new grad, I think a lot of people and I definitely was afraid of like making things worse. Obviously, I'm not out to try to make things worse, but I'm more comfortable now with like, okay, if it makes it worse, then that's just more data. And that just means that, maybe we go in a different direction for a little bit and then come back to it. And again, like I said, I've evolved the way my practice style like so many times just as I learn things and as I gain more experience. And I feel like some people probably just never evolve and they just stay afraid of causing more pain forever for like their whole career, maybe. But then back to the pain, like I usually just have a guideline, like, okay, if your pain, you come in, if your pain is already less than 5, then 5 is going to be the threshold. If it goes above 5, okay, we're going to hold back. But if it stays under 5, then we're going to like continue. If their pain is 5 or above already, then I'm like, okay, let's say it's at 5 already. If it goes to 6 or 7, like that's acceptable. But if it goes higher, let me know, and then we'll try to manage this and so I think that makes most clients and patients feel a little bit better, that like they start to realize like, okay, just because there's pain doesn't necessarily mean that they're damaging anything, versus I know I did this a lot in the beginning of my career, where if they're like, "Oh, this is painful," like I would freak out, and then it would make them freak out too. And
Yeah.
so, one is staying calm, but two is just understanding that a little bit discomfort is going to happen, but it's not the end of the world. It's just giving you more data on the client.
Yeah.
Hopefully, that answered it.
No,
No, it
yeah.
did.
All right. So while I have a quick aside. It's because I ran an experiment in the background while y'all for continuing to do something here because I was curious. So I created an assumption based off of normal prerequisite courses or bachelor's degrees that would then translate potentially into a DPT, right? And roughly 50% of doctorates of physical therapy are typically going through an undergrad that would have like kinesiology, exercise science, or some athletic training degrees. And then there's like an assumption that probably 70% of those people likely participated in high school, college, or recreational sports.
Mm-hmm.
And then with the other ones, they said roughly, maybe let's just assume 30%. And then AI spit out that roughly 50% of physical therapists likely come from some level of sports background. So
Perfect.
there's my hypothesis. I'd like to test it though. So if anybody out there is like at UNLV and they want to go survey a 1,000 DPTs,
So,
or maybe there's a network that you can introduce me to, Kelsey, so I can kind of get an understanding of like
dude,
how many of these people.
dude, kinesiology is kind of crazy. It's still like one of the youngest degrees technically. It's
I
only
don't
4
even really
hours.
know what kinesiology is. But you guys both
Study
majored
of
in
human
that?
movement. Yeah, it's a study
Oh,
of human movement. But
so what's the difference between that and biomechanics, or is it kind of same but different?
Biomechanics is
biomechanics is a part of kinesiology.
Yes.
Oh,
So I went to UC Irvine, and they didn't even offer a kinesiology degree until the year after I graduated. So I think their first class was like in 2015.
And that was the time that it was starting to be required to be a DPT. Because I remember going in. So I went to Cal State University
wait.
Northridge, which well, biomechanics. So kinesiology, you have the biomechanics, but you also still have physiology and anatomy.
Mm-hmm.
Uh-huh.
And when you work into that, and then when you go to the higher level stuff, it's like there is a lot of math, but the math isn't like it's more about energy units and math, and
Yeah, because
it's not that difficult.
I know.
And probably Angle.
The only thing I have in my head is the story of I had two pre-med majors that I lived with my sophomore year, I guess. Technically, I don't even know where I was because of like college credits, whatever. And we were both taking physics, but mine was like physics for engineers, which is like versus like
Dude,
physics for pre-med. And they basically got like worked out nice like equations where they just plugged and chugged and and then
dude,
over here
the
over
most amount of physics you need for physical therapy is like waves and magnetism, and like that's about it. Like physics 1, physics 2. That's like
So
yeah,
I was
yeah,
like,
yeah.
EM is like the hard physics.
No,
Because I was pre-med also, and then yeah, the biology / pre-med, and then yeah, the physics for the biologist was definitely easier because my husband has 2 degrees actually in physics. So he
he's
was
the
like,
next
"Yeah, your
Oppenheimer.
guys' physics is way easier," and I was like, "Well, this is hard."
yeah,
Yeah,
like
I mean, it just depends on the prereqs in the school you went to. Like I was saying, I went to Cal State Northridge, and getting my degree in exercise science, like that was the year that they were like, oh, you need to have a doctorate to become a physical therapist now. Like you need to, and I was like, yo, what the fuck? Like I thought, like you needed to just go through school, so like get this police degree, whatever. And then they changed it up, and it became harder because you needed to have certain qualifications and. But at CSUN at Cal State Northridge, only like 1% of the nation gets into their physical therapy program and their athletic training program. So like if you wanted to be a physical therapist, it's effing hard. But if you wanted to be an athletic trainer, it's also effing hard too. But like being an athletic trainer though, like the pay wasn't as good as physical therapy. And then like with physical therapy, you also had outpatient. And it was just like people were like, I don't know, at that point in my life, I was like, I'm out. I love coaching. I love coaching people. I love being a personal trainer. I love nutrition coaching. I'd rather do that.
Yeah, because yeah, for what you wanted to do, because yeah, for athletic training, I feel like you would kind of be stuck with schools. Well, I guess some work in clinics, but like for the most part, it's schools. But at least I feel like the return on investment, even if they get paid less, athletic trainers, I mean, I feel like, but you don't have to pay for the doctorate degree. At least before, now you have to pay for a master's. But like
Yeah.
the return on investment might have been better. I'm not sure.
I'm not sure. I feel like both were difficult in their own right, and I think it's interesting because when I got into it, the reason I didn't want to become a physical therapist anymore was I fell in love with coaching, and like my mentor told me, he's like, either at this time as a mentor, he was running a gym. He's like, learn how to run a business with me. If you're a personal trainer, you need to learn how to run a business and become an entrepreneur. You still need to do that, right? If you're a physical therapist, technically you still need to do that even if you're in a hospital. Because I went to physical therapy at Kaiser, he's like, you still need to learn how to like manage systems and business. And even if you don't work for a hospital system, well, what are you going to do? You're going to run a business. So learn how to run a business. So even if you become a physical therapist, you know how to run a business. And so I kind of went with him, and then I fell in love with just coaching. And then all the like technical stuff around like physical movement and reading all the movement books and getting certifications, I was like, yeah, it would have been really difficult to go to school and pay this much money, because like
Yeah.
I'm already like learning how to run a business and make money. I'm like, I think I'm good here.
Yeah, I am very, oh my gosh. I am fortunate that I was able to use the GI Bill for it. So I didn't have any debt, but yeah, a lot of my classmates got a lot
Yeah.
of debt. So,
That's what I hear.
um,
Like that's what I
yeah.
hear. Like a lot of folks are like a lot of physical therapists will still be in debt for like quite some time.
Yeah, that return, the thought was by making it a doctorate degree, we would, one, get more autonomy. And I don't know if they even thought about the pay thing, but yeah, pay has not done anything. If anything, it's getting worse because reimbursements are getting worse for the ones that take insurance. And autonomy, again, like for me, I don't take insurance, so it did help on that end. But for those who still take insurance, even if the state has direct access, meaning that because Nevada has direct access. So even if people are allowed to see a physical therapist without a referral, like most insurances require a referral anyway. So it didn't really end up doing anything except
Yeah.
increase people's debt.
And you just get to say you have a DPT and
And
doc,
then doctorate, yeah.
but it's like, you know, like
Yeah, it's like it didn't really do much.
I think that's why I think like my mentor said it before, kinesiology is this field where we're almost like striving hungry artists because we want to help people, yet we're doing it on a dime. You know what I'm saying? Like
Yeah.
we're literally doing it on a dime, and it's like that's why when he stepped in my life, I really appreciate this guy, by the way. He's like, learn how to run a business, and it doesn't matter if it's a PT business, a trainer business, but like a business, because at some point those skills are, and this is Marcos and I talk about this like this morning, like those business skills are going to translate more than like the technical physical therapy skills in your life. And I was like, I agree. I agree.
Yeah. And even just like with the field I'm in and with my niche, like sometimes I wonder if I should have done an exercise degree and just called it a day because with the amount of coaching, I mean, because that's my style, my treatment
Coaching.
style is coaching, and so,
Yeah.
or like exercise based, and so, and I think a lot of really good personal trainers, like a really good personal trainer, if I'm being honest, can be better than some, or is better than some physical therapists. But at the end of the day, and so that realization, like, it made me, for a long time, I was just like, okay, what's the difference between me and a personal trainer?
Well,
Um,
that's the thing, right? Like I know that like Marcos, we work with this other physical therapist. Like they can get hands on. They could do these cool different modalities. I couldn't do that. You know what I'm saying? Like as a
yeah.
coach, I'm like, yeah, we're doing some functional range conditioning. We're doing these mobility drills, and we're doing some like fascia stuff. But I can't touch you. Like I literally was like, I know it's wrong, but I can't do it.
Yeah, well, to be honest though, like actually my opinion of manual therapy has changed a little bit, but for a long time I was just like, no, manual therapy is stupid. And so that's why I
Hmm.
was like struggling with, okay, what's the difference between me and like just like a really good personal trainer, besides the fact that like I have this expensive piece of paper. But now I do know that like manual therapy isn't important. It's just not as important as a lot of people think,
Mm.
but it is important in certain instances. And even with like, I have my dry needling certification, but I haven't gotten very many people who are interested or have taken me up on dry needling, and so it's just like one of those weird things. But
I need to come through. I need to come. That was the one thing when Marcus and I, like that was the one thing that finally made my shoulders shift. Like I've done
I
a
think perceptions.
shockwave therapy. I've done other
oh
things,
yeah,
but dry needling was the first one that finally took like whatever was going on, the knots, it just released it. And I was like, yeah, I need this.
reset the muscle. Yeah.
Yeah.
But I think perception is everything. It just goes back to the pain model that you're talking about too, where it's not like there's nothing there yet. This person's saying they're at an 8 out of 10, right? Seemingly. And I mean, that's like part of the interesting part about I mean, the word therapy, I feel like is like kind of a loaded thing, right? Like
Yeah, yeah.
it's like the subject who actually gets relief, it might be 50-50, right? But like that mean why would you not try to explore that? Or if someone like thinks that they're going to get some additional benefit from it, then give it to them, right? And I think that's part of I don't think that was always part of the model for physical therapy, right? Because obviously we know insurances will only pay out for certain levels of care based off
Hmm.
on whatever model and maybe some dated literature from over 25 years ago. Whereas now, like, some of that manipulation for someone like me, I'm like, man, I get a lot of value out of that, right?
Yeah.
Like, I mean, and it's why I kind of prefer doing more of like the cash payer through an HSA, and so I can get what I'm looking for out of therapy versus just whatever is by the book.
Yeah,
Because
because like
Yeah.
Marcos, like the best analogy for that is like, look, there's a junkyard car, right? They need to get fixed up, needs a lot of work. You're like a Porsche, right? But you just want to keep running good, you know? And that's why I think like with some physical therapy, it's like a tune-up for the Porsche, you know?
yeah,
Yeah, and then so when you brought up a good point about like so before when I was like, oh, manual therapy is dumb, like we don't need it, but like some people really do need it and they see really good benefits. Randomly, like so as an aside, I randomly got like really into treating the foot, and I think it's because we didn't really learn too much in school, and then so I feel like and I ended up taking kind of a continuing education course on it, and so I feel like compared to a lot of other people in the clinic I used to work at, like or my patients were seeing results a lot faster with what I was doing. And what I was doing was like a lot different than like the standard, like pick up marbles with your toes or whatever. Like I don't do that because it doesn't actually do much. But anyway, and so now I'm realize and so when I changed my mind and started realizing like, oh, sometimes that manual therapy, like it really does make changes and it really helps them. But on the flip side, because I think there is a clinic here in town where they advertise like everybody gets like the 15 minutes of manual therapy or like the massage or whatever. And it's like, well, not everyone needs it though. And so sometimes you just end up like moving their kneecap around and it's not doing anything. So it's just like wasting their time versus, somebody that actually does need it. And so I think it's like what changed my mind is my realization that like again, it goes back to that individualization, like okay, what does this person actually need and what's actually going to make them better? Because maybe the manual therapy will actually help them. Maybe two people with like the same shoulder injury, the manual therapy helped that one person, but that one person hated it and it didn't help them at all. So, okay, I guess I won't do it on that person, but I will do it on this one person who it seemed to really help and help them be able to do their exercises better. So,
Yeah.
um,
It's an
yeah,
interesting thing. I think there was a study on manual therapy. This is an old study, like the 30s, 40s, and like I think it was like Russia. Um, Inhumane study, but like touch for human people. Like they did on some babies or something like that. Like the ones that didn't get touched for 2 weeks after being born, the babies were like emotionally distraught, really
mm-hmm.
messed up. But then the babies that did get touched, like they were managing pain or they're doing fine. I think there's something about human touch, even if it doesn't do anything manually for the person sometimes, even if
Yeah,
it's not. But I think like for the nervous system, for the person's like well-being, like that's why I like to get like a weekly massage. Like I don't think it's doing anything per se that's gonna be so crazy. Like
mm,
maybe like a physical therapist doing like some active release technique or like joint manipulation or whatever. But I'm like, I just need that 1 hour of like nervous system reset, and I think that to
yeah.
me is more important than like, ah, yeah, your back is fixed now.
Yeah, so that's another thing too that like something that I've changed my mind about as well because I used to be pretty like single-minded like the people who for example get the weekly massages like you don't actually need that like it's a waste of money but then like you just mentioned though too like it's actually really important to you and it's not well for me it's more like especially now that I have a daughter it's like okay now I have to like like move schedules around and like plan around this. I'm like, I'm not like, even a monthly massage, I'm like, that would be nice, but like that's too much work to like deal with, and like the cost and
You
everything.
you could you could
But
you could tell that Seamus doesn't have kids yet, right?
I don't have
Weekly
kids yet. I just got
massage?
married. It wasn't weekly. It's probably like there was a point though when I was
Bullshit. You're
competing.
lying. You probably go
No,
right
there was a point
downstairs.
though. Yeah, probably. When I was competing in jiu-jitsu, that the guy that I love this guy's name's Randy. I would see him once a week because I just needed it every week. But he was also trained from a physical therapist and a chiro, so he would quote unquote do some manipulations on me. Don't tell him much. And he's really
you
decompressed me, and
said his name.
You didn't
but
know his last name.
he
No,
was really great because he
allegedly
actually
he did
knew.
manipulations. Allegedly.
Allegedly, I mean, but he did really good, like ART, some joint manipulation, things like this, and like I was like every single week, it was worth it because I was getting beat the f up. Now, do I need it every week now? Because I'm not in that space anymore. Nah, it's just more for here.
Yeah, so it's more like, what is it worth to you, and is it worth the cost for you? Like, I'm sure you're not trying to decide, okay, do I buy groceries or do I get this massage? Otherwise, I assume you probably wouldn't get the massage. But because for me, and it's, so where I was getting with that is like, a lot of times, for example, like people would come in, when I worked in the traditional clinic, they would come in, and then like physical therapy is not usually really quick. Like sometimes you can have like some relief, but like for you to have like lasting relief, it does take like around 6 weeks at least to
Hmm.
like see meaningful changes, to for the client to see meaningful changes. And so a lot of times they would come in, and then like it's like nothing changed after the first one, and then they wouldn't come anymore, and then they would go to like the chiropractor or something. They're like, yeah, I just go to the chiropractor like every other week. And then at first I was like, oh, that's dumb, like why would they do that? But then I realized, like, not everybody wants to have like that long-term fix. Again, like what else, even before I had a kid, like for me, I want something where I don't have to keep going to the chiropractor for, in this example. I'm not hating on chiropractors. There are really some really good ones and some really predatory ones, and same thing for physical therapy. It's same thing for any profession, really. There's good ones and predatory ones. But anyway, even before, when I was in the military, I had like, my schedule was, I did shift work. And so again, same thing. I didn't have the time to make these appointments and keep going to get adjusted. Like I would rather have a more long-term fix. But not everyone is like me. Some people, like, that's what they want and that's what they need. And honestly, I only realized this like a couple months ago, where I was just like, not everybody wants the long-term fix. Like, as long as they're okay with going to the like wherever, chiropractor, physical therapist, massage therapist on a regular basis, it fits into their schedule. The cost wise, it's okay. That's fine. The thing that I have an issue with are the ones that are like, no, you have to spend like 30 grand and come 3 times a week for the rest of your life every week. And I'm like, okay, in that case, I'm like, okay, that's extreme. Like, I don't think you need
Yeah,
that. But yeah,
Mm.
everyone's different.
Yeah. And I think too, like to be able to then identify, like again, if you're gearing more towards athletes, we understand that, like as my Cairo buddy over in South Africa likes to say, you get some niggles, like your
Yeah.
body is just like not functioning properly, and you're a little more aware to that. And so you just, like Shane was saying, you kind of go in for the tune up, right? You're like, I'm gonna be honest with you, I've been putting my tune up on hold for far too long. I was literally saying to Adam this week, I was like, all right, dude, like, what's wrong with my fucking elbow? And he's like, he's like, yeah, he's like, it's fucked. You're effed. That's it. And I was like,
cut
okay, I
it
probably
off
should.
though.
It's like, oh, thank you. That
I
doesn't
think I
help.
figured it out though. But like, going in for more tune-ups, or people that are, again, more geared towards kind of like our niches, so to speak, right? People that are like kind of willing to pay cash, willing to kind of get in with a little more high touch in a sense. Like, I think that there's an incredible amount of value, and it's not predatory to like kind of have like a retainer for your nutrition coach and
Yeah.
your physical therapist and the person there. And again, too, like you mentioned, like a lot of people, that like getting the rest of the work done, like the homework in a sense, right? Like the other sessions outside of your guys's like session is where most people falter, right?
Hmm.
So how do you make it as sticky as possible so that they can like see the benefit of it? Like, because you're already saying 6 weeks, and that sometimes that can feel like an eternity for people, especially if it's like return to play or just return to walk, right? Like, like I'm sidelined because I tweaked my ankle, non-athletic person. I stepped off of the curb wrong. We've all done it. We've all rolled an ankle, right? But it's so bad that this person is like, I just want to have the ability to walk again, like you said, right? So, I mean, at the end of the day, it's consistency and the accountability that you can then provide with like your practice. And that's like a huge differentiator. Like you just said, this person might see you twice a week for 6 to 8 weeks because they ain't got to go anywhere. They just need someone to show them what they need to do. So, I mean, again, to me, I'm like, I would fall in line with that. I think my mom would benefit from it because sometimes like she likes the in-person thing, but like not every session. I feel like a hybrid PT would be where it's
Hybrid
at,
PT is
or
the
having
name
it.
of the game, man.
Yeah, hybridization really is. I feel like because like I feel like going to that place, it has an aura, it has a vibe, or it can, depending on the location. And you're like, I'm going to get better here. And if you get better, there, guess what? You already associate getting better to that place, right? So there's something powerful about that. And at the end of the day, too, like you said, like you're dispelling your previous beliefs. I think that kind of happens as we're all continuing to move out of that lower end of the Dunning-Kruger curve, right? When you think you know everything and like my way is the best way. I'm down. You're really down
Yeah,
here.
it's like as we evolve, yeah.
That was me with CrossFit, Marcos. When I hit CrossFit, I was like, CrossFit's the way to go. Paleo's the way to go.
Well, it's funny too. It's just like fucking fashion, guys. It's like everything becomes cyclical, right? Like, is CrossFit the way to go? I mean, maybe, but like there's elements of it that I think will cycle back. And we have obviously seen how gyms have changed their footprint, like a traditional gym, not like a CrossFit gym, to have more elements of that. Whereas before it was like you go in there and it was just like being a hamster, right? Like you have every
Yeah.
piece of like cardio equipment you could possibly imagine. So I think the future really is like, again, like kind of these unique circumstances with individualization, hybridization in a sense. And I know for a lot of people I've talked with recently, like, cause I don't really, if I'm coaching nutrition, it's primarily nutrition, but there's now programming in there and a lot of people like, hey, I would get a lot of value for you just showing up. Mind you, like my certification is actually in CrossFit. So like, what am I actually doing here? Like I understand movement patterns and things like that, but like, I guess technically, like if someone wanted to take me up on, writing programs, like, oh, who are you? It's like, I don't know. I'm not a DPT. I'm a CFL2, which I understand these other principles, but I think they all correlate, you know?
Yeah. And then I was hybrid for a while, but
You had a
again, it was just like, what?
You said you had a kid?
Or yeah, that played a big role in it. It's just like how it was just trying to make enough money to pay the rent was so stressful. And then so there is that, and then having a kid just makes the stress even higher. So it's just a little bit easier to be fully virtual now.
Oh yeah.
How old's your kid?
She just turned 8 months. So
yeah,
she's in the thick of it, Seamus. She's right in the thick of it.
She's in the trenches. Do you plan on having a second?
We'll see how our public health infrastructure is like in 2 years. I'll just leave it at that.
That's a great point. Yeah, we'll leave it there. I mean, so I wanted to ask you, I know you're fully hybrid now and stuff like that. And I just kind of want to lead into like some of the offerings that you have, but like what are like the physical therapy like modals that you like to work on? Like is there like a specific like issue that you're like, I'm a specialist in this. This is what I like to do.
Well, I have taken courses in pelvic health. I don't have my certification yet because I need to do one more test at some point, but they changed the certification right before I took the course. But anyway, so I do pelvic health as well, mostly working with postpartum pregnancy or people who pee themselves basically when they're doing stuff in CrossFit, like jumping, running. They don't have to be CrossFitters. I've worked with a runner, lifting, all of that stuff. And again, the foot and ankle, weirdly, I am super interested in that. I think it's mostly, like I mentioned, it's kind of, for me, it's kind of like low-hanging fruit because I feel like a lot of traditional physical therapists who don't take extra courses on the foot and ankle just don't rehab people very well. And so there's a lot of people who are like, yeah, I had a lot of ankle sprains or whatever, had a broken ankle, got surgery, whatever, got rehab, but it's still, it's still screwed up, but that's the way it is now. And I'm like, no, it doesn't have to be. I can help you. So yeah, foot and ankle is something that
What are like before we go forward? I mean, I feel like the whole like pelvic floor thing, and I'll go into the foot. Like what are some quick tips for people? Because I remember going into like a pelvic floor specialist like cert with like Brianna Battles back in the day, and like they were like the ones that like pioneered like
The
basically some of
the coaching, yeah.
the pelvic floor coaching. I remember
Wait,
like
you went
that's when I
into a
learned
clinic,
about.
you were having issues with incontinence?
No, not me, but a lot of my clients were, because I remember, dude, like I remember it was so funny because I was going through my undergrad, and I remember like I should get this shirt, and like it was like this like it was this course or whatever, and it was funny because the next day I tried it out, and this is how my group classes were going on. So Kelsey, like I would do jumping jacks, half the room would go to the bathroom, and I was like,
Yeah.
what the heck's going on? And then like I went to this conference, and they're like, this is what's going on. So that day, like I got the thing. So right before I would do the jumping jacks, I'll be like, all right, all the ladies, let's go ahead and just tuck that tailbone in and belly button into the spine and just do the jumping jack and try to keep that. And like, no one peed. And I was like, what the fudge? Like, what happened? And then I was doing some one-on-ones, and a lady goes like, it's kind of interesting that, I got this 20-year-old kid telling me what to do with my body. I'm like, I know I'm a young guy. I know you're like, you've had kids and you're having some issues there, but just try this. And like their pelvic floor got better, strength got better. But then that's when I got into like understanding like diastasis recti as well,
Mm-hmm.
postpartum. And it's like, I feel like the reason I want to bring this conversation up and want to talk about this is for the woman listening to here, it's like they deal with this stuff. They go to a group class, they have back pain and stuff, but they don't realize it's like, it's lack of pressures in the
Yes.
pelvic, and it might be this lack of connective tissue. Can you kind of like speak upon that,
Yeah. So, or it's lack of pressure management, I guess it's that's a better way of saying it. And then it's more of, so I'll speak about diastasis recti for a little bit. Most women, or every woman, is going to have it during pregnancy. There's no way to avoid, if you're somebody who is pregnant, there's no way to avoid diastasis recti because it happens so that there's room for the baby. So every single person who's been pregnant will have diastasis recti right after birth. It does resolve on its own. I want to say maybe 6 months post after giving birth. I think I got measured because I did get a pelvic floor exam just to make sure and everything was okay. And then maybe I had like a finger width. That's how they kind of measure like finger width, and then they also measure depth. My depth, I didn't have any depth, and then maybe a finger width gap, but it was fine. It wasn't like affecting anything. So I think a lot of women don't realize, like usually around 6 months to a year, it actually kind of goes on away on its own for most people, not everyone. So for some, you do need a little bit of extra help to fix it. And for a very for a minority end up needing surgery, but not every woman. And but a lot of the stuff with the some women will think that their diastasis recti is what's like screwing up their core, but I think a lot of it is the fact that throughout pregnancy, so this all starts with the pregnancy itself, because the common knowledge is like, oh, when you're pregnant you can't do any of these things. And so I'm part of like that group of, so we talked about ageism earlier, so this isn't necessarily sexism, but it's like now people are afraid to load older people. People are extra afraid to load pregnant people. And so if somebody's pregnant and they're not working out for the entire like 9 or 10 months, of course they're going to be super weak. And so it's not necessarily the diastasis recti itself that made their core super weak. It was probably the 9 or 10 months of where you weren't doing any core work that made it super weak,
Yeah.
along with like the stretching of it. So
Yeah.
with that, with pelvic floor, a lot of it can be managed if like someone is like, oh, I don't have time for therapy or whatever. Like some really quick tips is, one, stay hydrated. A lot of women will like dehydrate themselves to not pee. That actually makes it worse because urine is a bladder irritant. So what that means, the more concentrated it is, the more the bladder is going to want to get rid of it. So staying hydrated is a big thing with plain water. Second is the pressure management piece. So when breathing, for example, like breathing into your like thinking about breathing into the rib cage, expanding the rib cage and not breathing down into the pelvic floor. And then also not being afraid of core work. And working on your core, and then also not trying to hold a Kegel, because I think, or like pelvic floor contraction, because a lot of times the issue isn't the strength of the pelvic floor, it's the motor control. So a lot of women, they're really good at activating their pelvic floor or squeezing it, but they're, especially type A women, they're not good at relaxing it. And so it's like, if it's already contracted, if you need to contract it even more, there's nowhere for it to go. And so it's like just gonna, and then also trying to contract it for a really long time, it's gonna get tired. And then so if you try to load it more, it's just gonna give out. And then so a lot of times that's when leaks happen. Those are kind of really general like pieces of advice: is stay hydrated, don't try to hold a Kegel, and learn how to do 360 or umbrella breathing where you're expanding your entire rib cage and not just like parts of it, if that makes sense.
Yeah. That's a three-step process. And that's it's interesting too, like you just said, it's kind of unavoidable when it comes to like the recti, right? Or recti, whatever.
Diastasis recti.
It's recti, okay. And
Yeah, I think it's recti.
and just the again, I'm sure like because everybody has to deal with it, it's definitely like you just said, it's like potentially the lack of strength after the stretching happens. And it's, I mean, I feel like when it comes to post baby, what I mean, what is it? Goodness gracious. Postpartum. There you go. Like the postpartum checklist. Hell, there might be something for you right there as like a postpartum checklist, because I feel like there's a bunch of like little steps for people, whether it is actually like return to quote play, right? Whatever that is. But I think for a lot of women, they do commonly avoid that. Just like with nutrition, I mean, I don't think women really realize this, especially if you're breastfeeding. Like, it's not the fucking time to diet because you have
No, it is not.
right.
This is the worst time to diet.
Like it and with the you know, again, I'm a man, so I'm not like a postpartum specialist when it comes to nutrition, but far too often I feel like people will underdo their healthy fats and they probably need more of it. Right. So there's a little freebie of like postpartum and like also dealing with other stuff. Total calories are probably too low. And, you know, if you're going to err high on anything, it would definitely be the fats, because especially if it's like you want actual like satiating milk to be produced, like the healthy fats are going to get you there. And the calorie load will be far easier too. I mean, I look back at the instance with, you know, that particular person I'm thinking of, and I was like, this individual got to like the leanest state that she'd been at. And it was about a year postpartum, still breastfeeding. She was eating like 2,400 calories a day. Like, ladies, like you got a fucking free pass for a little while. Like, produce that milk. Like, I know it's probably more convenient not to, but like, you know, as a guy, I would say like do everything in your power to try to help stimulate that production. You know, if it doesn't work, it doesn't work, right? I get that. But if you can, I would like highly encourage that, because that could be a spot where you can actually like boost your freaking metabolism just from like going through, you know, the process of like doing what your body's supposed to. Yes. And then after the fact, cool, you're like, cool, let me focus on getting my body back. Let me focus on getting my, you know, my health. After witnessing 2 pregnancies with my wife, and it's just like little things there. She's like, oh yeah, like I definitely like slacked on like my pelvic floor stuff and the exercises, but I feel so much better and my back doesn't hurt and this doesn't happen. And, you know, she can go CrossFit with, you know, no issues now after, you know, 2 kids and 7 years later. Right. So I feel like the checklist of like postpartum for PT nutrition and stuff like that, we should work on that. We should work on creating that.
Together. We should do a little like little PDF together. I'm down.
Oh yeah. So I actually do have, it's like a postpartum return to exercise, a little bit more, what did I call it? Return to exercise. It's not a checklist. It's more kind of like a flow chart of guide. Oh my gosh. Postpartum return to exercise guide. I have that for free. It's a free PDF download from my website. And it really goes over like the big concepts of, again, if you're going to breastfeed or exclusively pump, like this is not the time to diet. Definitely stay hydrated, get those calories in. And then it also, like, going back to exercise is really, it's a lot more complicated than people think. And especially experiencing it firsthand, because there's a lot of that mental thing too. Because it's like, okay, are you going back to exercise because you really want to, because you yourself want to, or because like you think other people think that you need to? If that makes sense. So it's like that guide kind of touches a little bit on all those little guides, guidelines before returning to exercise postpartum. And
Yeah.
there's like a mini timeline, but again, timelines are, everyone's different. And there's this big thing about, I already forgot her name, Andrea, it might have been Andrea Nisler, who she competed and one of like, I think the CrossFit quarterfinals or something, like 6 days postpartum, I think. It was like an online, but still, like she was still doing competitive CrossFit like right after she gave birth. And a lot of people were like, oh, that's terrible. It's like, she got cleared by her physical therapist and her OB. It's like, and I think I want to remind people, it's like stuff like that shows what is possible, but it does not show what is the norm. And so I think there's like two sides of it where people will look at that and be like, I should be able to do more at this stage postpartum than I am. And some people will look at that and be like, that is extreme. No one should be able to exercise like that. But like for me personally, mentally, I could not go back to CrossFit for 3 months. I did not go back to CrossFit for 3 months. Like physically, I actually felt a lot better than I thought I would. And I do credit that with being fortunate enough to be able to exercise throughout my pregnancy, but I feel like I probably could have gone back earlier, but just mentally I was just not ready. So that's like a huge thing that I think a lot of people don't realize, like how big the mental component is as well.
Super big. I mean, that's the difference between like being the person that like could do it and then like you play a pickup ball and you rip your hamstring, because mentally you've done this move a million times, but physically your body hasn't done it in 20 years, or a year. But yeah, I get it. I think I like what you're saying. Like the timelines is subjective. It's a good guideline, but it may depend. You may be sooner, you may be faster.
Individual results.
That's why, I like more of like achieving milestones versus like a straight, like at 4 weeks you should do this, and like at 6 weeks you should do this, and so
convince that to a new mother when their kids aren't making the cognitive leaps that they need to.
Oh my gosh, I've had to, like, I'm convinced. So obviously I'm following like pediatric PTs on Instagram because I was terrible at that in school. So I forgot everything. As soon as I took my boards, I was like, nope, forget. But yeah, for a while, I am convinced that if you have like a developmentally normal child, like there's nothing wrong with it. Like all of the little things are like, oh, help your baby to crawl. Like it's just keeping you busy because the kid's just going to do it when they're ready. Like all the exercises where they're like, if you get your baby to crawl, if you do this, and like I think rolling, my big thing was rolling. I was like, oh, why isn't she rolling yet? And no, I was like doing all the things, and then I think I gave up because I got stressed out. And eventually, like I said, she just rolled on her own one day. So it's like if they don't need that intervention, I feel like a lot of those exercises from like social media are just to keep you busy until your baby decides that.
Why isn't my baby Einstein yet? Why isn't my baby Michael Phelps yet? What the fuck?
Why can't my baby pick their big old head up off the ground on tummy time yet? Just like, oh, like can I help strengthen my baby's neck with a little bit of resistance training?
Put iron neck on him.
Well, yeah, and I think again I think it's great you have some guides for that. And I think also being able to help. The whole idea behind this podcast, like keeping it like super true to us, is giving people the platform to like come and talk and talk more about like what they're passionate about. And I know for myself and Seamus, it's helped over the years now, just communicating with each other and all of our fabulous guests, that it helps us identify to our core, like kind of our niche a little bit better. Right. And so again, for you, obviously you have a guide that is like geared towards people, ladies, obviously, which is great. And then also too, being able, like you just said, it makes a ton of sense. If you're a new mom and you're staying home for a little bit and you need to be working on these things, you gotta hit me up so we can have that accountability of like return to play, return to being able to do a lot of like normal things in your life. And, the trajectory or the milestones are probably a far better approach to getting there versus the timeline in a sense. I think I like that too. And
less stressful.
Yeah, because the goalposts will always move, right? The milestones are important because you kind of get there. And just because you signed up with something thinking that it could happen in a 6-month period, you don't know all the little stuff that's going to happen in between that, right? Every quarter.
That's the same thing with like everyone that signs up for nutrition coaching or physical training coaching. It's like in 3 months I need to be this. It's like maybe 6 to 9. Like let's give a bigger runway.
Yeah, and I mean. I try to always be very careful with my words now with like it in an ideal scenario, this is what it could look like. Boom, 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 boom. Right now, does everybody really line up to being ideal? It's like usually no. You're usually outlier when it comes to this because it's your first time, it's brand new, etc. But one of my clients, 3 months into it, basically he's like hit every milestone of like 1% of body weight per week. I told him the first 2 weeks are going to be some hiccups, and you're going to get better, and you're going to have more awareness, and then blah. Like he's like now and it's just like it's funny because it's like if you follow the coach's guidance, we can get you there. We can get you there in that period of time that we're telling you, and we're trying to be honest about it. But at the same time, too, it's like it's required to put in the work, just show up, be consistent, and get your body to perform from a nutrition standpoint or from a physical standpoint. Just God, just be consistent. Find ways to be consistent. And I think again, shoot, I look back at like, hey, did I do my homework, with it? I mean, if we had virtual apps that like a PT loaded in all the movements, like a training program for me when I was a kid, when I had to do PT for shoulder issues, I probably would remember what the exercises were. But like, he did something with a band. I don't remember what it was, but I know I should be doing it. And I'm sure that like, I mean, I'm not really in that world to be able to be like around kids that are having to go through that, but I would imagine it's a whole new it's probably a whole new world in a beneficial standpoint. It's like, hey, download this to your phone. You get your Trainerize app. Here's your movements. Here's your recovery protocol. It's laid out for the next X amount of weeks. And we're going to check in on it. And I'll make some modifications based on what you like, what you don't like, what one's helping you get relief. Like, again, it's just personalized.
Yeah. And that was like the biggest thing that I saw too, where, yeah, people would forget the videos are way better than like the papers that we print out, pictures. Sometimes
Dude,
the pictures aren't even what we want.
all the clients that send me like, hey, this is what a physical therapist wants to send me like a packet. I'm like, gosh dang, bro. Like I know this movement, but I have to YouTube it still because like I
Yeah,
don't
to
know
the
Yeah.
how
Stone
they want to
Age.
execute it.
Sounds like
Like,
a Kaiser PTs, Seamus.
so, I mean, that's like pretty, like, yeah, the printout. And then, or sometimes, for example, I had, and then this is the patient that really convinced me to have my business this way is that he had a high deductible, I think, and then his copay was like $100. So he was obviously only coming once a week, and this is when I was at the traditional clinic. And then we got to the point where he could bench press again, but the clinic didn't have like a traditional bench or anything, so he couldn't do it in the clinic. So I was like, okay, I gave him the instructions. I'm like, okay, this is what you need to do, and then so try it. And then so the next week he came back, and I was like, okay, how'd it go? He's like, oh, I didn't do it. I'm like, why not? He's like, oh, well, I got scared, and also I forgot what you told me. I'm like, well, I mean, I understand because I did give you a lot of instructions. I was like, there has to be a better way because, like, I forget things. Like, as soon as I leave the clinic, I'm going to forget. So, like, if I was a patient. So,
That's why
yeah.
notes are important from a clinician standpoint, and that's why sometimes just having that person there is also super important. You mean to tell me he didn't remember 4 points of contact, pin your shoulder blades back, try to squeeze this, do that, armpits like this, just all to do this one simple exercise where you press the bar away from your chest? That, I mean, sounds crazy.
Not technical at all, bro, when you have like life's weight on you.
Hey, dude, I don't even touch anything lighter than 225 anymore. Probably is to my detriment, but I'm ready to go.
Yeah, I'd be jacked to be touching 225 consistently, bro. Shit.
Well, I don't touch anything lighter than that, Seamus. What you know about that? Probably not a good thing. PT
I,
in the room is telling
I'm
me I should
not.
probably warm up more.
I know, bro. Yeah, dude. Okay, I'll be honest with you. So, Kelsey, like all I do, like now, part of my program is some works. Is like I've been focusing on internal rotation and loading that up a lot on the
You've been
shoulder.
watching too much Alec. What's his last name? Blenis. How do you pronounce it?
Alec
Blenis.
Lennis, yes, hybrid athlete guy. But no, I tell you
Oh,
what,
okay.
there has to be something about internal. I don't know if they've done studies on this, but the crazier you can load up your internal rotation shoulder wise, I bet you that like transfers to every other movement in the upper body.
So, yeah. So, well, I think it's because it's one of the things that people forget about unless their subscapularis is the one that torn, so there's only one muscle of your rotator cuff that does internal rotation, and that one's like the least common to get torn if somebody has like rotator cuff surgery. So, and that's also like usually the easiest versus external rotation. So a lot of times like no one really works on internal rotation. They always work on external rotation. Same thing with the hips. Like everyone's always like stretching like pigeon pose or like the butterfly. They're always stretching like into external rotation, but never into internal rotation. And usually I'm like, hey, can you do like, what if you did like the 90-90 thing?
Mhm.
And then they're like, oh, I feel so much better. I'm like, yeah, because you've been cranking on the other side and you weren't like
Doing
evening
the
it
other
out.
way. It's like
It's
a
like if the
golfer,
one
you
thing
know.
isn't working, maybe try the opposite thing and see if that helps.
Yeah, that's what I tell the golfers. Like, I'm like, you swing a million times right to left. Can you try left to right? And they're like, oh my gosh, like my hip issues kind of fix themselves. I'm like,
Or yeah, it's like if you're only going in one direction, like maybe you don't have to do it equally because obviously like with tennis players, for example, like if they're right-handed, their right side is like super huge and like their left side's like not as big. Like, well, for your sport, like yeah, you need the right side to be super huge for like to play tennis, but it's like, well, work the other side a little bit though. Like don't just ignore it. And it's like you have to do the opposite sometimes. And same thing for
yeah,
endurance athletes. They're like, oh, I run all the time, so I must always work on endurance. It's like, no, like take a little break and work on some strength too. And I promise you'll feel a little bit better. Like you'll hate it probably. You'll hate the strength training, but you'll
yeah.
probably feel better.
Just to Marcos's like comment, Marcos, what is it? I'm, what is it? It's like I'm a shitty runner and an average, not even an average lifter. That's what I'm. That's what I train for.
I
Or
love
just be trying to be
it.
mediocre at everything. That's what I do.
There it is.
I know,
It's like
God.
for like CrossFit, it's like I'm a CrossFitter and now I want to do triathlon, which is also multi-sport. It's like, oh, my goal is to just be mediocre at multiple things and like not good at any one thing.
That's what I
Yeah.
call exercise selection ADD, and you're constantly looking for new ways to keep a novel idea and keep the training inviting. But at the end of the day, too, lately it's just been nice to be on autopilot and be like, man, I've been doing this for like 6 weeks. It's probably time to change it up. Like, not that it's dry, but like, I think I've milked this segmentation of this mesocycle, like for all it's
Mm-hmm.
worth, you know? So I mean, at the end of the day, too, that's probably why you're like wanting to do that. And so many people want to kind of go after something that they haven't done before because you don't have a PR with it. You don't have any idea or understanding. So you just getting it done in and of itself is a new accomplishment. So there we have it. And yeah, guys, well, this has been fun, Kelsey. Thank you for coming on, and hopefully, I know you were a little scared to come on initially when I asked you, but hopefully you've alleviated some of those nerves now, and there'll be more podcasts for you to go enjoy and be a part of, and just start finding your voice even more. And as Seamus and I have learned over the years, like it's kind of scary in the beginning when you don't know, like you're obviously the expert, and I think it's evident, it's clear, and we're just trying to find ways of like, like you just said, you removed your biases in certain areas. Then the more I think you talk about and then kind of espouse what it is that you think can really be beneficial, more people can then take that and learn from it. And we'll obviously have your stuff linked up so if people want to go there when it comes to being able to find you, we'll have the website and then maybe the link directly to that PDF guide on the channel. So if you guys are listening or watching on YouTube, it'd be easiest to find it there. It should be in the show notes for every other platform as well. I just don't know if it's hyperlinked. I don't even know because I don't even check it. Seamus, do you know?
It should be. And then Kelsey too, this should be out in about 4 weeks. I think you have an event in August as well, or like a
Yes.
type of campaign. Like what do you got going on so people might be able to join it?
So I have two things in August. So starting in August, I'm going to be doing the very first postpartum, or I called it postpartum power program. So it is a 4-week course where women who wants to get back to exercising after having a kid. And it doesn't matter if they have to be cleared by the doctor, by their OB. It doesn't matter if they're 6 weeks postpartum or 6 years postpartum. If they are a little bit intimidated with returning to exercise, this program will be for them. It'll be the first one will be 4 weeks, and it'll have I'll be sending them lessons, videos, and then also we'll be meeting in person for an exercise class at Branded One CrossFit as well. So there should be more details as we run up to that, and that'll be available. The details will be available on my website. And the second thing that I'm having in August, on I believe it's the third Saturday. I forgot what exact day it was, but I'm going to be having a shoulder workshop also at Branded One CrossFit.
Awesome. Well, we'll we'll have all those details linked up as well. And if you're in the local Las Vegas area, feel free to drop by and say hi during those things. I'm not sure if you're recording it, so people can maybe do a Zoom version or whatever, but maybe we'll have those details listed as well once we get everything hashed out. So
Yes.
ladies, gentlemen, boys, girls of all ages, thank you again for listening to another episode of the Macro Perspective. We appreciate the small cult following we're gaining here, Seamus, right? Critics are raving. Critics are raving and saying that like this is what was the damn it. I gotta go
They
to
said it's the best health podcast on the web.
oh my
Well,
god. I gotta find it. Wait, is that
It
what
was
it
a
was?
screenshot by a producer, so it's a bit
oh,
biased.
nice.
A
Well, I think
screenshot?
if you're like not weird, I think like Andrew, like Huberman used to be really good, and then like I feel like he's kind of become a sellout a little bit. I don't know, but
No, he still has, I think, relevant information. It's evolved, and I think that I think that's part of the problem with health at times. I can't find the stupid post, whatever. We'll just say critics.
Yeah, it's the critics are worried, but it's the problem with like the pod. I mean, we'll talk about it after. But hey, guys,
Yeah.
yeah, thanks so much, Dr. Kelsey's really appreciative. If anyone needs help with their pelvic floor, physical therapy in the Vegas area, online coaching with it as well, hit her up. We'll see you guys later.
Peace.
thank you so much.